Our next speaker, I'm very delighted to say, is joining us from the background and training in Israel and the USA. She trained at the Pacific College of Oriental Medicine in San Diego, and she's now been based in the UK for quite some time, specializing in fertility treatments, and works with the Homerton University Hospital, where she's been doing this incredible trial, which she's about to tell us about. And she said that one of the researchers as part of her team had to eat their hat because of the results were so unexpected. So I'm very much looking forward to hearing Karin Gillerman.
Hi, good morning. I have to say I presented this research in two very large conferences, medical conferences last year, and it's much more exciting to present it to an audience who actually understand when I say PC6 what I'm talking about. We've been leading this research for the past 3 years. We are trying to assess the effects of acupuncture on IVF success rates and on live birth rates. And we've been doing it at the Homerton University Hospital at the Fertility Center. It's one of the largest fertility centers in London. We cater more than 1,500 IVF treatments per year. I have to say that the idea for the search, for the study, came out from a need. I've been practicing for the past 17 years in the UK, and my clinic is mainly fertility and IVF treatments. And as I've been in the field for quite a while, I'm lucky to have referrals from GPs, from specialists, from gynecologists, but most of the gynecologists and the GPs want, especially in the UK, I find out, want and don't refer their patients, women who are undergoing IVF treatments, to acupuncture. And it's not just ignorance. They don't have evidence-based conclusion, evidence-based proof, if you can say, as to say, yes, to their patients, yes, you can go to acupuncture because it will help your IVF treatment, it will help your success rates. And I've been debating this issue with IVF specialists over at least 10 years. And every time I show them a study, to show them, look, this study just published and showed that IVF is efficient and beneficial for that acupuncture is effective for IVF treatments, they come up with a different study that shows the opposite. And I think the main thing, the problem is the heterogeneity, the extreme heterogeneity with all those different studies, because they differ significantly in different timings of acupuncture, different protocols, different study designs, different outcome measures. So this extreme heterogeneity really, due to this heterogeneity, we can't come to a conclusion whether acupuncture is beneficial for IVF treatments and should be offered by physicians to women undergoing IVF. To address, by the way, that's why we did that, and we took a specific protocol to address this extreme heterogeneity in 2012. 15 international acupuncturists with extensive experience treating IVF treatments with acupuncture gathered together, and they reached a consensus protocol. They participated 3 rounds of Delphi questionnaires, and they've agreed on 86% agreement, which is quite a lot, on a specific protocol to use with acupuncture in IVF treatments. I want to read you something that they have, make a bit of a noise. The conclusion of this trial in 2012 was, despite a lack of homogeneity in the research and clinical literature on ART and acupuncture, a consensus amongst experts on key components of the best practice treatment protocol was possible. Such consensus offers guidance for further research. The problem is that since 2012, no one has taken this consensus, this protocol, and done anything with it. So I took that protocol and brought it to the Homerton, and after a year of difficult work, managed to convince them to do that. So I explained to you, I'm going to present the research to you. Not working? Okay, first of all, there's no conflict of interest. We didn't get any fund of any company or anything. So again, what is already known? As I said, there are clinical trials to assess the benefits of acupuncture IVF treatments. They have differing study design, protocol, outcome measures, and commercial bias. And this is precluding any firm conclusion regarding the efficiency of, or otherwise of acupuncture in that field. As I said, to address this heterogeneity, 50 international acupuncturists participated in Delphi questionnaire and reached a consensus protocol to be used in future research, which so far as we know, hasn't been implemented. To the best of our knowledge, this is the first time that someone actually took that protocol and did something with it. This is something that Elizabeth Stenner has published in 2006. She took 4 very large randomized controlled trials, and she showed they all different protocols. She talked about lack of standardization. She really talked about the placebo effect. Can you talk about placebo effect when you measure something so objective, such as live birth rates and pregnancy results? And in her research, she showed increased uterine blood flow. When we talk about uterine blood flow, it's very critical for the success of the IVF treatment to have good uterine lining. So when you have evidence-based conclusion that acupuncture treatments with specific acupuncture points can increase uterine blood flow, it's extremely important. This was a single center randomized control trial comparing 2 arms. The control arm, so it was 80 women who received the normal IVF procedure, and the study arm, another 80 women who received, again, the same IVF protocol plus acupuncture according to the consensus protocol, according to the Delphi consensus protocol, which agreed. And the primary endpoint was to determine the clinical effectiveness of acupuncture in improving live birth rates in women undergoing IVF. The secondary endpoint was clinical pregnancy rates and some complications such as OHSS, ovarian hyperstimulation syndrome, which is extremely dangerous with IVF treatments. The inclusion criteria was women no more than 43 years old with BMI no larger than 30, undergoing the first or second IVF treatments, either frozen cycle or fresh cycle. Are you familiar with those? Fresh embryo transfer or frozen embryo transfer. Inclusion criteria: women who are receiving donor eggs or currently having any acupuncture or any complementary medicine. And those women, after we got their consent form, went through randomization. It was computer randomization. I didn't do the randomization. I didn't pick up who's, it was randomized controlled trial. So we didn't pick up who's going to be in each group. A computer did it, okay? That's our lovely team from the Homerton. Let me tell you a little bit about the process, okay? The reason it took 3 years, it's not very easy to recruit patients to such a trial, and let me tell you why. So basically, I came to the Homerton on the days of the clinic, and I had to see with the nurse from the nose of the patients if they fit into the criteria. Once I saw that those women, those patients fit into the study criteria, I had to convince them and to try to talk to them to get into our research. Why is it difficult? Because when you come to a patient who's been going through, by the way, most of those patients, it's not the first cycle. They already had a cycle of IVF who failed. So they are, they're coming with a big emotion distress. And then you tell them, listen, we're doing this research here at the Homerton at the Fertility Center, and you can be part of it. And it might increase your chances to get pregnant. It might increase your chances of your IVF treatment to succeed. But then you tell them, but if you sign the consent form, you're going through randomization. You might not get into the acupuncture group. And then you will say, just a moment, I already had a failed cycle. I really want to get pregnant. And the reason that we got the other how to resolve it, we said to the patients, if you get into the acupuncture group, that would be great. If you get to the control group and that cycle has failed, we guarantee you that on your next cycle, you will receive acupuncture, free of charge. And that was the only reason we were able to keep those patients in the acupuncture, in the control group, because we had to make sure that the patients who signed the consent form after randomization, when they get into the control group, they won't give up and say, I want to withdraw. I don't want to stay in this trial. Also, we had to make sure that the patients who are randomized into the control group, I mean no acupuncture, won't go and have private acupuncture when we don't know about it. And then it changes the whole thing, okay? So the patients who fit the criteria went through the randomization. We gave them, before that, we gave them oral information and written information. And after 2 or 3 days, not 2 or 3 weeks, after 2 or 3 days, we met them at the clinic again, and we received their consent form, and then they went through the randomization. With 160 women participated at this research, 80 women in each arm, 80 women in the IVF only group, and 80 women in the IVF and acupuncture group. Again, I will say that the acupuncture group, the IVF and acupuncture group, they received 3 acupuncture sessions according to the Delphi consensus. The first acupuncture session was between day 6 and 8 to ovarian stimulation. We used acupuncture points as to stimulate the blood circulation to the ovaries, as to achieve good follicles in quantity and size. The second and the third acupuncture sessions were on the day of the embryo transfer, pre and post transfer, okay, as to stimulate the blood flow to the uterus to achieve good lining. As well, we'll discuss it later, some acupuncture points to release endorphins, to work on the nerve system, so the patient will be relaxed. The patient from the acupuncture group, from the research group, also received quality of life questionnaires, which they had to fill twice. On the day of the consent form, mean before the acupuncture sessions, and on the day of the embryo transfer, after the embryo transfer, means after 3 or 4 sessions of acupuncture, okay? And then we measured the results of the questionnaire of the quality of life. The primary outcome was live birth, and the secondary outcome was clinical pregnancy rates. This is just to show you, it's really difficult to see from here, how we analyzes, this is just an example, how we analyzes the results. So for me, it was important to show, this was very important for me to show, especially the medical world, that first of all, it was a randomized controlled trial. Second of all, that there was no demographic differences between the 2 groups. Because I wanted to show the people that the same women who received the same IVF treatment didn't have any differences between the age, between the BMI, between their hormonal profile. So I didn't want them to say, okay, maybe in the acupuncture group, the patients had the better AMH, which is ovarian reserve, or that the patients in the acupuncture group might have better hormonal profile. No, you will see later that regarding the demographic chart, there were no changes between the 2 groups, okay? So there were the same women, different ethnic, we had Japanese and Chinese and Jewish and women from Nigeria, women from Croatia, from all Eastern Europe. There was no differences. And we collected the data here. So you will see here was the hospital number, the age of the patient, beta HCG, which is pregnancy result, which group she was randomized to, acupuncture or control, which infertility, is it primary infertility or secondary infertility, which is very important, which cycle is it the patient, is it her first cycle or her second cycle, which diagnosis is it, why does she have unexplained infertility, does she have a reason for her infertility, is it tubal, is it unexplained infertility, is it polycystic ovary syndrome, is it endometriosis, is it a male, is it like a morphology of the male sperm, which protocol she had, antagonist or agonist, long protocol or short protocol. I'll explain everything later if you want to. AMH, How many eggs collected? We wanted to see if in the acupuncture group we were able to collect more follicles, and the embryo grade, and if it was a fresh cycle or a frozen cycle or embryo grade. We wanted to see if between the two groups, the acupuncture group and the control group, we had different results regarding to embryo grade. We don't transfer embryos if they don't reach a specific quality. And embryo grade, we have two grades. We have top grade and average grade. So this is all the data we collected. And some people said, why? Well, it took a long time because you have to collect all the data, but it is very important. When you want to reach evidence base, as my colleague talked about, evidence base, you have to have all those data. So, 160 patients were randomized, 80 to each group. As you can see here, we had many more dropouts at the acupuncture group. Can you think about why? So we got to a conclusion that the reason that we had more dropouts in the acupuncture group was because you have to understand those women, the IVF procedure is not fun at all. Those women are getting pumped with hormones. They have to come every day or every second day to the hospital, to the clinic. They get pricked. They have the trigger shot. They have so many blood tests. So yes, they want to get better results for their IVF treatment. So they signed the consent form, but the dropouts were because when they actually thought about it, and because some of them were really ignorant with the field of acupuncture, they said, you know what, I don't want to have acupuncture. I don't want to have to come for more appointments at the hospital. I don't want to have to get, although it's not, acupuncture is nevertheless nothing to do with the shots that they were got, but they didn't want the extra appointments and the extra, acupuncture needles because they've been pricked on a daily basis anyway. So that's why we had more dropout in the acupuncture group. Per protocol, we had 30, this is, by the way, old results. Our results from a week ago is even higher. We had significant results. We had more, here we talk about 31% live birth against only 16% live birth in the control group, which is quite significant. This is a huge gap between the two groups. Miscarriages, we didn't see any significant results regarding to the miscarriage between the two groups. Positive pregnancy test, again, 56% in the acupuncture groups, opposed to only 27% in the control group. This is quite a big thing, okay? Again, this is another data. We didn't see any significance between the two groups regarding demographic data. What we did see, again, BHCG, positive, 48% in the acupuncture group, upon to only 31% in the control group. This is quite a significant result. Per protocol, it wasn't significant. Again, diagnosis, it wasn't significant. The main significant results between the two groups were the live birth rates, which were much higher in the acupuncture group, and the pregnancy results, which were much higher in the acupuncture group as well. Again, you can see in this chart the gap between the two groups, okay? And this is acupuncture followed by that specific protocol that was reached among 15 international acupuncturists, that they came out, they said, this is a fixed protocol, as you call it. And I know that when I talk about it with my colleagues from the traditional Chinese medicine world, there was a lot of, I'm trying not to say judgment, but a lot of judgmental. Why do you use fixed protocol? In my clinic, when I have a patient who comes and she's going through IVF, I wouldn't treat her with a fixed protocol. I'm going to do the diagnosis, to check her pulse, to check her tongue, to see if it's an excess, to see if it's a deficient, to see if it's a cold condition or a hot condition. I'm going to do the whole thing. But for the research case, we had to use that fixed protocol to say, listen, it's true that there is a huge heterogeneity in that field, but we can actually use that fixed protocol and show you that we reached great results. And if we're going to repeat that study and do it 2 more times, and if we're going to reach same great results, I think this is something which is quite phenomenal, which gives and brings evidence-based proof that acupuncture should be offered to women undergoing IVF treatments. The strength of this study is the first to follow a widely approved consensus protocol and therefore has set a standard for future studies. It was a randomized controlled trial with power sample size. Now let me talk about the limitation. Some people, especially my colleagues at the Homerton Hospital, said, listen, the additional attention paid to the acupuncture group might have a positive psychological effect on that group. Maybe that's why you had better results. But I have to talk about it. And luckily, I was able to convince Professor Homburg and my other colleagues. I think when you assess something subjective, such as general well-being or pain or mental stability or emotional stress, yes, you can definitely say that extra attention to one group might have a psychological positive effect on that group. But when you assess something so objective, such as live birth rate, you can't come with this. Definitely not. I must say that in Israel, what they've done, I think it was 6 months ago, they tried to take women who went through IVF procedures and they gave one group some counseling and some reflexology, and some of the ladies even had massage and facial treatments, and they reached no better results. So when you measure something so objective, such as live birth rates, extra attention to the acupuncture group, it won't have any psychological effect. The effect will be by stimulating the blood circulation to the ovaries, by stimulating the blood flow to the uterus, and by working on the nerve system, and by choosing specific acupuncture points as well as to relax the patient. As I said before, the acupuncture group also received quality of life questionnaire, which they had to fill up on the day when they signed the consent form, hence before the acupuncture, and on the day of the embryo transfer, hence after having acupuncture. And again, we had great results here because for the questions circulated to patients before and after undergoing acupuncture, do you believe acupuncture can contribute and add value to the success of your IVF treatments? Before it was 7.68 and after it was 8.58. And the quality of life questionnaire was about how do you sleep, how do you function in your daily life, do you have any night sweats, do you suffer from depression, how's your relationship, do you snap, are you irritable, bowel movements, many questions. And the question of life, the quality of life questionnaires came much better after the acupuncture sessions. The conclusion, the results of this study imply that acupuncture should be offered as a possible method of improving IVF outcome. We now intend to investigate the pathway in which acupuncture increased pregnancy rates with specific attention to measurements of nerve growth factor and hormones of the autonomic nerve system. So why do we do that? We have beautiful scans and beautiful scans and ultrasounds, but it's nice to see patients that while they were stimulating with hormones, we used Clomid and Gonal F and some drug that I'm not allowed to talk about here because I'm not a doctor, but we had patients who received all the medications they were supposed to receive and they weren't stimulating. So the follicles went as many as we expected and they haven't reached the size that we wanted to retrieve them. And after a couple of sessions of acupuncture, 2 sessions of acupuncture, the ladies in the acupuncture group were able to continue their cycle, hence the acupuncture helped them to stimulate, and the other patients who weren't stimulating well in the non-acupuncture group, we had to stop their cycle, which means, again, failed cycle, okay? So it's nice to see on the scan, so you see, this is quite amazing. 25 minutes before the acupuncture, you see patient with, let's say, 8 follicles, measure 10 milliliters. and 25 minutes and 40 minutes after acupuncture, stimulating Zigong and CV4 and stomach 28, you see 16 follicles and measured 18 milliliters, which is quite amazing. And it's nice to see actually the faces of the doctors in the fertility center, because they just, I think for the first time, they actually see it happening. Because just before then, when I used to come before we started the research, they used to see me as the crazy lady who does something to the patients to get pregnant. But I think when you actually see those scans, when you actually see those ultrasounds, you can really see the effect of the acupuncture on the women who are getting stimulated with drugs. That's about it. If you have any questions, I'm happy to answer. Thank you.
That's a great story, to know how you got into the hospital and develop this project within the NHS. I think it's, these things are not easy at all, so well done on that kind.
I have to say something that I received some emails over the last 2 years about people who asked me, we really want to do research, we have a great idea for a study, how did you do that? It's definitely not easy. It is definitely not easy. Just to go through, first of all, to convince the fertility center that we must do it, that we have to do it, that it will be worth for them to do it. It was a great deal. But then to go through the ethics committees. The ethics committees are very, trying to choose my word without being judgmental. It can be hardcore with the questions. But if you really have great experience in your clinic, in a specific method or in a specific technique that you do, and you truly see great results, I just think you really have to go for it and just believe it's going to have a great outcome. That's it.
Yeah, good point. Yes. So this opens now to questions. Further back. Yeah.
Thank you, Karin. I practice in the United States in New York. I also went to college.
Oh.
So I was wondering why you didn't pick sham acupuncture? Because in the States,
exactly.
Okay,
I know. We're going to talk.
and
Okay. Of course.
So I was wondering if you could.
I actually have a slide for that, but I don't think we have it here. The thing with sham acupuncture, again, the first design of the study, we had a third arm for sham acupuncture. But then my research instructor, Professor Homburg, came to me, and he has nothing to do with traditional Chinese medicine, the opposite. The opposite. He was quite judgmental to the whole system. And he said to me, Karin, everything, all the data you showed me, the latest studies, by the way, from Beijing, and from Boston University of Medicine, and from San Diego, and from Austria, and one by Elizabeth Stenner, which is quite recent, they showed that acupuncture, the sham acupuncture, is not even relevant. Because when you do sham acupuncture, when you pick up, well, there's three sham acupuncture. There's the tape sham acupuncture. There's doing acupuncture close, not really in that specific acupuncture point, but close to it, or doing acupuncture which is irrelevant for that specific problem. But each acupuncture point has its own domain, and it affects the body in every way. So you can't say sham acupuncture is a sham acupuncture, because if someone say, okay, I'm not going to acupuncture CV3, or CV4, I'm going to acupuncture 0.5 Sun from CV4. There's an extra point there. If you say, I'm not going to acupuncture fertility-defined acupuncture points, I'm going to acupuncture spleen 6, so I'm going to acupuncture back shoe point for the spleen. Still, it will have an effect on the body. So there's no sham acupuncture when it comes to fertility, but in my opinion, when it comes to research, there's not such a thing as sham acupuncture, because every acupuncture point that you're going to acupuncture, if it's the real acupuncture point or if it's just close to the real acupuncture point, it has a direct effect on the meridians, on the body function, and on all the systems of the body.
Right,
For
thank
that
you.
reason, I didn't choose. I didn't pick up, and I didn't decide.
Yeah, just, I mean, it's
So-
showing how sham is working.
Yeah. So
I'll
we've got a
back
question
if
that-
you want. Yeah.
From the back and then back to the front.
I can't hear you. I'm sorry.
Sorry. Presentation of the data, was the protocol data or intention to treat?
No. It was intention to treat. Okay, intention to treat. Per protocol was, when I say per protocol, as I said, we had some dropouts. We had one patient who died, unfortunately. As I said, OHSS, ovarian hyperstimulation syndrome, is extremely dangerous. So we lost one patient. She didn't get any acupuncture or anything. It's not funny, but so we had some dropouts. We lost one patient. We had some patients who the cycle had failed, so we couldn't conclude it. So this is intention to treat, not per protocol.
Yeah, no. That's what I'm asking.
Okay, yeah.
Big difference.
Yeah. A huge difference, of course, yeah.
I think the per protocol, you should do a between group comparison. Did you do an intention for treat comparison between groups in terms of live births?
Yes, we did actually, and that's why I'm missing 5 slides. I don't know why. So yeah, I'm missing 5 slides. So I'm sorry. Is that the only one that she downloaded? Yeah. Okay. Sorry.
So just out of interest then, what was the outcome between groups using intention to treat?
Between groups using intention to treat was, it's quite amazing. It was 40% in the acupuncture group, opposed to, I think, 21, which is quite, it was, again, we were quite, I have to be honest, I wasn't expecting those results. Not at all. I wasn't expecting those results just because one thing, because that's not the way I treat patients in my clinic. I do many more than just 3 sessions. I do at least 6 or 8 or 10 sessions during an IVF course. I see patients twice a week while she's getting stimulated. I see her twice before the egg retrieval, and I see her twice on the day of embryo transfer, but I see my patients before they actually start the IVF sessions. So I was quite amazed that from 3 or 4 acupuncture sessions, we had that great results. And I'm actually really happy that we actually took that consensus protocol, because I think, again, if we repeat that protocol, if we repeat that fixed protocol, as we call it, and we reach the same results or close to the same results, or hopefully maybe even better, I think that then you can actually come to the NHS and say, listen, we can show you now that maybe part of the protocol, of IVF protocol in the NHS, must include 3 sessions of acupuncture.
Good, thank you. Mike?
My question was about the intention to treat analysis. On your slides it said per protocol, and I don't understand how your intention to treat can be greater than your per protocol results. But, that's been asked already, so...
Yeah, okay.
So, it's not published yet, is it?
It's going to publish at the end of April. So, yeah.
Just for information, the intention to treat analysis, you keep all the patients in the groups that are allocated, and you don't count dropouts, and then you do the comparison. So that's slightly different than per protocol, where your dropouts are excluded, so
Yes.
you don't actually have 2 equal groups, because you've lost some people for reasons that might be systematic
Yes.
in some way. But anyway, I think this is a great study. We've got time for a couple more questions. Mayong Su? Oh, no, it's not. Sorry. Yes.
I have a question. Do you have an intention to research on the particular traditional acupuncture
Okay.
including IVF patients?
Sorry, your question was?
Do you have an intention to research into the therapeutic effects of individual traditional acupuncture points in treating IVF patients?
If I have the intention, I'm happy to talk about which acupuncture points we've used, if that's what you want, if that's interest of you. Sorry? So you'd like to talk about the specific, of course, with pleasure. So that's what you've asked, yes? Okay, the specific acupuncture treatment that was used, if you want to discuss it, I have it here, which is the one slide that, one of the slides that I don't have here. Sorry, we don't have the slide, but I'm going to tell you anyway. So, acupuncture points is to stimulate the blood circulation to the ovaries. We used CV4, Zigong. Are you familiar with Zigong? Yes. Zigong, CV4, stomach 28. I specifically prefer stomach 28. Giovanni prefers, I studied with Giovanni Maciocci and he always prefers stomach 29. I don't know why, but okay. So CV4, Zigong, CV3. CV3 is better, I believe, for stimulating the blood flow to the uterus, okay? Less to the ovaries. CV4 is more to the ovaries. Kidney 15. Kidney 15 is extremely important as to break blood, especially patients with history of endometriosis. I always used kidney 15, okay? Kidney 15, CV4, Zigong, stomach 28, spleen 10, as to stimulate the blood flow to the uterus. Large intestines, colon 4 plus liver 3, yin tang. This has nothing to do with the ovaries. This is, as you know, the 4-gate treatment. This is to relax the patient, okay? We used stomach 36 and spleen 6. Kidney 3. I like to use stomach 30 because stomach 30 is the chi of blood. Sorry, C of blood and chi. So stomach 30 is one of the points that I mainly use for fertility. Regarding the, but those points are on the stimulation stage, so day 6 to 8 on stimulation stage. I have to say that the Delphi protocol said one treatment during the stimulation stage, but when I had a patient and she wasn't stimulating enough as expected, on the day I saw her, I sometimes told her after the scan, come again for acupuncture, okay? And I stimulated manually. The Delphi consensus reached agreement for 3 main things. The first one, they agreed on the specific acupuncture to be TCM, traditional Chinese medicine acupuncture, not 5 elements, no anything else. TCM acupuncture, manual acupuncture, and 3 sessions. The first one, as I said, day 6 to 8 for ovarian stimulation, and the second and the third on the day of the embryo transfer, pre-transfer and post-transfer. When I say pre-transfer, sometimes people ask me, so can it be the night before? Can it be 5 hours before? So no, it has to be an hour or half an hour before. Yes, you can do it the night before, but again, it won't have the same effectiveness. So we do, is that, you understand? So we do, I saw the patients half an hour before they went to theater, okay? The points I used pre-embryo transfer were spleen 8, spleen 10, large intestine 4 plus liver 3, stomach 29, CV4, sometimes yin tang, sometimes PC3. I didn't use Shen Men. And the post-transfer, again, when we say post-transfer acupuncture, it has to be straight away after the acupuncture. You can't use GV20, which is extremely stimulating. The reason we use GV20 post-transfer is to bring the chi up, to hold the embryo there, okay? You can't do stimulating, such stimulating acupuncture points an hour after the embryo transfer or a day after the embryo transfer. So when you see a patient after the transfer, it's better if you see her straight after the transfer, okay? So the post-transfer acupuncture points included GV20 with no stimulation, kidney 3, stomach 36, spleen 6, and pericardium 6. Again, sorry, we need to finish. Okay. You can choose to use auricular points such as Shen Men if you find that the patient is extremely distressed.
So I think thank you very much. I think we're running out of time. I think that's been a great talk. It's fantastic to see this sort of study happening in an NHS context, and I echo the point how difficult it is, but incredibly worthwhile. So please join me saying thank you to Karin. Okay, we have now a coffee break.